Now let's talk about asthma and albuterol. Asthma is an extremely frightening problem to have when a person has such tight airways that though they believe they're taking a breath in, they cannot feel that they're getting enough oxygen. It's extremely scary, and if you ever wanted to kind of get an idea what it feels like, try breathing in and out through a coffee stir stick straw. This is about the approximation of what it would feel like in a severe asthmatic attack. It's extremely scary. Now let's talk about one of the best medications to use for an acute asthmatic attack and what to do to use it correctly. So, albuterol is one of the first primary medications that's prescribed to someone who has acute or chronic asthma. Whether it's exercise-induced, like the scenario we just saw, or whether it's from a person that has persistent asthma, it doesn't really matter. The effect is pretty much the same. Albuterol usually comes in a container that looks something like this. It may be a different brand name, it might have a slightly different color, but in most cases it will be in an aerosol type container with an actuator like this. But more importantly, we forget about this. This is called a spacer. Now, one of the reasons I believe that most people don't have them is because in many cases they're extremely expensive. Now, whether that's right or wrong, that's the case. And I think many people, when they have to pay for them out of their own pocket, they say, I don't really need it, I'll just use this. The problem with that is that the majority of the medication, instead of getting inhaled into your lungs and your bronchioles where it's supposed to go, it ends up in the back of the throat and on the tongue. And therefore it decreases the full dosage and the effectiveness of that dosage. But important steps to take when you have the proper equipment is to shake your albuterol prior to using it. You don't have to shake it for very long, but make sure it's mixed. It should also be sure to have actuations remaining. If you look on the back of most of these, you'll see a number in that little window. It should not be 0, or it should not be 000. So also check the expiration date, make sure it's not expired. Now that we've shaken it up, we're going to insert it into the actual spacer. Now, and I'm actually prescribed albuterol, so I'm only taking what I'm already prescribed to take. I'm going to place the actual spacer into my mouth. Now I'm going to go ahead and push down on the actual container, which will send albuterol as a mist into this spacer into a nebulized form. Then I'm going to blow out and then inhale and hold my breath for 10 seconds like this. The normal dosage is 2 inhalations, so you would repeat it. Go ahead and let your air out. If you do not feel relief from these 2 inhalations of albuterol, you usually are prescribed how soon you can repeat it. If you're not feeling relief soon and you're still having difficulty breathing, it's important to call 911 and get the ambulance on the way, as you may be having a persistent asthma attack that will not stop with a simple rescue inhaler of albuterol. Don't assume that it's going to get better. Call 911 and get help on the way in case you're in a true respiratory emergency.